Now, there have now been over 10 million reported cases of coronavirus worldwide, and more than 500,000 people worldwide have lost their lives. On average, more than 4,700 people are dying around the world from Covid-19 linked illnesses every 24 hours. That's according to Reuters calculations based on the average for June. That equates to 196 people per hour, or one person every 18 seconds. So in the time it takes to watch a 90-minute soccer match, 293 people would have died on average. The US, the worst affected country by far, has more than 125,000 deaths, with the number of new cases surging in the south and the west. Florida reported a staggering 9,500 infections on Saturday and another 8,500 on Sunday. The figures have increased fivefold in just 2 weeks, with officials blaming the increase on a rush to socialize again after weeks in lockdown. The average age of people infected in the state is now 33, down from 65 2 months ago. In Texas, the number of daily cases has risen from an average of about 2,000 to more than 5,000, which the state's governor has called a swift and very dangerous turn. During a visit to Dallas on Sunday, the U.S. Vice President Mike Pence urged Texans to wear masks. Have a listen.
Wear a mask wherever it's indicated, or wherever you're not able to practice the kind of social distancing that would prevent the spread of the coronavirus. And we would strongly reiterate that today. I know that roughly half the state is under local ordinances. Strongly recommend, if your local officials in consultation with the state are directing you to wear a mask, we encourage everyone to wear a mask in the affected areas. And where you can't maintain social distancing, wearing a mask is just a good idea.
Mike Pence there. Let's go straight to Laura Podesta from CBS News, who joins me live from New York. Laura, good to see you. We were hearing there from Mike Pence reiterating wear a mask several times there. This has become a political issue. So is this now a political shift?
It certainly is a change in course, Yalda, for the vice president to say wearing a mask is a good idea, because we know for so long the vice president, the president, really anyone from the White House was deflecting any comment regarding a mask and really leaving it up to the governors to make decisions about mask wearing on a state-by-state basis. We are seeing governors in California, in Nevada, in North Carolina mandating that their residents wear masks when they're out in public or when they cannot be within 6 feet of another person. But so far, there has not been any form of federal mandate saying everyone here in the U.S. has to wear one.
Laura, we're also seeing a surge in many southern states. Just tell us about this U-turn, especially when it comes to reopening.
Absolutely. U-turn is a great word, because in places like Florida, where all of the beaches were open at one point, now we're hearing that some are going to be closed ahead of the very busy July 4th holiday weekend this coming weekend. So a real reversal in course for the Republican governor there to say that there is an issue that he says was brought on mostly by young people that have contracted the disease, but could potentially pass it on to the elderly and the more susceptible. In Texas, bars are no longer allowed to be open and restaurants have to be at 50% capacity. It's a similar story in California, where Governor Gavin Newsom has shut down all bars in Los Angeles and several other counties. So really, this is a state-by-state situation where some, like here in New York City, we're seeing phases to reopen moving forward. But in the southern states that are being hit hardest now, we're seeing that U-turn.
Laura, we're also hearing from the pandemic task force saying they're better equipped now when it comes to dealing with the pandemic compared to where the US was 3 months ago. Is that what you're hearing?
Yes, and I think there's a multifaceted answer to that question. We know that hospitals now are better prepared with PPE for their doctors and employees, with ventilators. We know that doctors who have been treating patients for months with coronavirus now have better treatment options. They know what works and what might not work. There's also better contact tracing. There's more testing going on nationwide. So even though we're seeing increasing numbers, a lot of that is because so many people are being tested, and a lot of the people that are becoming positive, testing positive for coronavirus are younger people. So that's why we're not seeing death rates skyrocket as the number of positive cases skyrockets. I also think we have a more aware public. Back in March, when everything was shutting down, we didn't really know that coronavirus had landed in some states. So you had people walking around, touching things, breathing on one another, talking to one another in close proximity, and contracting it. Now, if you are someone who's elderly, if you are asthmatic or susceptible in some other way, you're going to be much more careful. So overall, yes, treatment and just knowing what's out there, we're just more aware, more educated.
Laura, thanks so much for bringing us up to date there. That was Laura Podesta joining us live there from New York City.